Welcome everyone to today's webinar, Implementing a Successful Multi-Factor Authentication Strategy for Healthcare. I am Laura Dierda with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. In about a week following the webinar, we will be sending all registrants a copy of the presentation to the email you used to register. At this time, it is now my pleasure to start today's webinar by introducing our presenters. First is Dr. Robert Lackey, Associate Chief Medical Information Officer with WellSpan Health. Next, we have Colin Schultheis, Project Manager at WellSpan Health. And finally, we are pleased to have Dan Borgasano, Director of Project Marketing at Imprivata. I'll now turn the floor over to Dr. Lackey to begin today's webinar.
Well, good afternoon, everybody. If we could have the next slide, we'll briefly take a look at our agenda. And I won't spend too much time here. We'll kind of go over what WellSpan is, some of the challenges we're facing, and considerations for how to do what we did, and then tips for success, followed by some additional information. So go ahead with the next slide. And briefly about WellSpan Health, you can see from all the yellow dots in the map and where that map is representing that South Central Pennsylvania with Harrisburg to the north and Baltimore to the south. We have a bunch of hospitals and a bunch of offices. We are now at around 19,000 employees and 1,500 physicians and advanced practice clinicians. We do around 2.3 million outpatient visits per year, and we don't try to toot our horn too much, but we've gotten some awards. I did want to mention that as a not-for-profit organization, WellSpan doesn't specifically endorse any product or vendor, but on today's webinar, we'll be sharing our experiences with what we found worked well to solve some of the issues that we're facing our organization. Next slide, please. And so when it comes to cybersecurity and challenges, multi-factor authentication is kind of a hot topic these days, and we'll go ahead and share our experiences here. Next slide. And as I'm sure other organizations are facing, WellSpan receives suspicious access attempts from all over the world, including China and Russia, and we get those attempted accesses with some frequency. And WellSpan doesn't want to be the next headline as the organization that was the victim of ransomware or that had a serious PHI breach. And we are told that weak or stolen passwords account for a large majority, and this slide says 81% of attacks. And phishing is just one example of how hackers try to obtain usernames and passwords. And of course, like all responsible organizations, we did the right thing, right? We educated our users and told them that WellSpan will never ask you for your username or password, and you should never click on a link in an email unless you're certain that that email is safe. And you should never give your username and password to anyone. We wondered how successful that education was. So we did some studies. And next slide, please. We sent mock phishing emails to all of our users, and at that time it was close to 16,000 users. And we found that about 2,400 of them would go ahead and click on the link in the email, even though they weren't certain that it was safe to do so. And then an additional 4%, or about 100 users, actually proceeded to provide their username and password. And so this just proves what we all know, that education only goes so far in preventing humans from doing the wrong thing. Next slide. With multi-factor authentication, we can still be protected when a hacker gets a hold of a valid username and email. And in case you have no idea what multi-factor authentication is, just ask your 10-year-old who plays Fortnite. Fortnite's gaming company, Epic Games, is encouraging all of their users to use multi-factor authentication to access their gaming accounts. So it's really ubiquitous in our society these days, but this is one way that we can protect our systems, even if our usernames and passwords get out there. Next slide, please. And multi-factor authentication is important to implement for any access points into your network, into your systems. There's also considerations for how to use it best in clinical workflows. Next slide, please. And one of those important workflows has to do with prescribing, especially controlled substances. With paper prescriptions, there's always the risk of advanced photocopiers that can simply reproduce a printed prescription, or people can make alterations to a printed prescription so they can inappropriately obtain larger quantities than you intended, or they can travel across state lines, for example. But basically, forgery, diversion, and fraud are a known issue with printed prescriptions. Those printed prescriptions also give you limited visibility into things like adherence, limited ability to write reports. They end up being less efficient workflows for providers. For example, the hospice patient who needs a refill of their narcotic medication on a Sunday at 4 in the afternoon. Well, beyond the issue of the pharmacy that might not be open, how do you get that printed prescription to the patient? There generally are exceptions to some of the rules for hospice patients, but just getting when the physician is at home, oh, I need to have that printed, but it's only going to print in my office. Now I need to drive to the office to pick up the prescription and get it into the hands of the patient. Those all become huge barriers. And so moving to electronic prescribing of controlled substances, that's EPCS, helps to solve pretty much all of those issues. Next slide, please. And EPCS, electronic prescribing of controlled substances, has a lot of rules around it set by the DEA. We'll go into a little bit of that detail in a minute, but there's all kinds of very specific requirements set forth in DEA regulations regarding making sure it is the physician or APC who is doing the prescribing, making sure that they are using a second factor of authentication, whether it has to be 2 of the 3 things, either something you know, something you have, or something that you are. There needs to be specific processes within the EHR that enable that physician or APC to use the system, and there needs to be, all around that, there needs to be very specific types of reporting available, and that's all necessary in order to be compliant with DEA regulations. Next slide. And so when it comes to trying to figure out what is the right solution for doing multi-factor authentication, there's lots of considerations, and this slide just lists a few of them. One of the ones that we found worked well for us is that we opted for a solution that was using a vendor we were already familiar with. We were already using the Imprivata badge readers for accessing our systems for single sign-on, and it turns out that the Imprivata vendor also had solutions available for multi-factor authentication and for electronic prescribing of controlled substances. After all those considerations, we ended up proceeding with the Imprivata vendor to help us with making these solutions. And next slide, please. So the Imprivata platform also, as is shown in that diagram on the left, has the one-sign product we're using for single sign-on access. And we're very proud of the fact that at WellSpan, we targeted our process for signing on to a machine to be less than 7 seconds. to give clinical access to our EHR and systems. And in working with this product and with our other processes, we're able to actually get that down to around 4 seconds. So we have a very efficient process for getting our physicians and clinical staff into their systems. And then with the other aspects of this vendor's products, we were able to meet our other needs for multi-factor authentication and for electronic prescribing of controlled substances. This vendor's product provides all of the necessary components to be DEA compliant, which made that a nice, easy solution as well. And the actual process of complying with the DEA regs on the prescriber's end is nice and easy. We chose to go with the use of the cell phone as the token, something that the physician has. So we used the combination of something the physician knows, the password, something the physician has, the cell phone. And the way that the app works on the cell phone is that it does not require the cell phone to be unlocked. Right on the lock screen of the cell phone, it presents the approve or deny button, the approve or deny option. And something that isn't really mentioned in these slides is that if the physician is using a smart watch, it's even cooler, it's even slicker. The approve or deny button is presented right on the watch. So all those features made it seem like this was a really good way to go. Next slide, please. And next, Colin Schulteis is going to talk a little bit about our implementation and deployment.
Hello, and my name is Colin Schulteis. I'm the project manager for the Multifactor Authentication project, as well as the Electronic Prescribing of Controlled Substances project. You can go ahead and go to the next slide for me. We've had a lot of success using, using this system recently, and the part of that success with the implementation involved a lot of early involvement from our implementation team. We recognized that it was going to be a mandate at some point in the future, so we put a lot of importance upon communicating this early and often. We made live our multi-factor authentication project for our Office 365 only a month before we went live with the electronic prescribing of controlled substances functionality. But it did involve a complete effort from all of our team members, and so that they each bought in and had ownership. I do believe that it takes strong project management and a strong project manager to maintain all of these milestones because of all of the different individuals that are involved, such as the business intelligence side for the reporting needs. We had our Citrix team highly involved. Right now, we are in the process of bringing our VPN completely behind the multi-factor authentication. So that involves setting up a Cisco test environment to make sure that we're able to integrate fully. So this involves so many different hands in the pot, and to have a good, strong project management staff is going to be vital. I guess you go to the next slide. And so the way we implemented it here was that for just doing multi-factor authentication for remote access, for example, we enabled our users to be able to do that from a custom website, so it made it fast and easy. They can also enter their phone number for texting. Although we don't rely on text messages for that multi-factor authentication, it's actually an approve or deny button. When we do the electronic prescribing of controlled substances, it's actually the enrollment there also completes enrollment for multi-factor authentication. But according to DEA regs, the identity proofing has to be done in person, and the enrollment of the token or the phone has to be done in person. We talked to other folks who had gone through this process and heard a lot about things like doing enrollment fairs, and that way you can sort of encourage your physicians to all come into a building or a location, maybe over a couple of days, and by that process you can get all your physicians and APCs to get enrolled. And
we thought, that might just not work here, where we have such a broad map that we got to get everybody to move around in. What we ended up doing was, under the institutional provider rules that the DEA regs allow for, we decided to just increase the number of enrollment supervisors, the number of people who could do the enrolling for the physicians, and we had an enrollment supervisor basically at every one of our locations. So we had our practice managers each be the enrollment supervisor for their office, and we had in our hospitals, we had our offices of medical affairs, the vice presidents of medical affairs and their staff. Those were going to be the enrollment supervisors in the hospitals. And there initially was some concern that those offices the hospital offices might get overwhelmed with a long line out the door on enrollment day. But when we did the math, it turned out that we were actually going to get most of our docs enrolled in their offices. And really the only ones that weren't going to be enrolled in the offices were some of our independent docs, not part of our organization, that practice in our hospitals. So it made it really manageable. At our largest hospital, I think we expected maybe 100 or so docs that might have to get enrolled at the Office of Medical Affairs. So that was one of our lessons learned that we'll touch on in just a minute. Next slide, please. And so this slide shows that we used our practice managers. The physician has to present themselves with their U.S. government-issued photo ID. A state driver's license is sufficient for that. And then that completes the identity proofing part. Then enrollment of the token. Although the picture here shows the physician using their fingerprints, we chose not to use fingerprint readers. We chose to use the physician's cell phone as the token. And a slide coming up will sort of list out all the different options, but we really felt that using cell phones as the token was going to be the best option for WellSpan. And if anybody wants to hear any stories about how do you overcome the physicians who are reluctant to enroll their own cell phones or don't want to have a cell phone, we can talk about that. In the DEA required process, once a physician is enrolled, there needs to be a changing of what's called logical access controls in the EHR system. And that, in EPIC anyway, that falls to the SER team. That's the team that manages the physician's profiles. And so once that message is received, oh, and by the way, to prove that this is not an endorsement, I'm going to maybe slightly embarrass Imprivata here a little bit. The process of the physician getting enrolled required communication to the EPIC SER team, and the recommendation for how to do that was to have the practice manager or the enrollment supervisor manually email the EPIC SER team. That's how we started out doing it. And we even checked with some other Imprivata clients in our region, have you guys found a better way to do this? And their response was, no, it's got to be a manual email process. Well, we figured out that actually the Imprivata software does have the capability of sending an automatic email notification once the physician is enrolled. So we enabled that ourselves. We told Imprivata about it, and we told our colleagues at other organizations about it, and hopefully they're able to leverage that functionality as well. But I guess it was maybe our implementation team wasn't aware of that functionality. But that just it's a nice feature. We're using it now, so that communication from practice managers to the EPIC SER team is happening automatically. Then within the EHR, again specified by DEA regulations, the EHR system has to send a message within the system to another group that gives the final approval. At some organizations, this is a physician role. We felt that at WellSpan, we didn't want to bother a physician with having to say, yes, I recognize my colleague's physician, and I hereby grant that person access and permission to use our system for electronic prescriptions. We thought that sat best with our credential verification office. We have a centralized credential verification office, so we delegated that responsibility to them. So they receive the in-basket message, the electronic health record message, and they evaluate whether or not the person has appropriate credentials, such as a valid DEA, and is a recognized physician licensed at one of our facilities. And if so, they grant permission. And once that is done, what's not shown on this slide is then the EPIC or the EHR system propagates a message through SureScripts to the pharmacies, to the pharmacy hubs, and there's a downstream step there that needs to be changed in the pharmacy receiving systems that says, oh, Dr. X is now going to be prescribing electronically. That process can take up to 48 hours is what we're told. Usually it happens faster than that. So we tell folks, we tell the docs, once you have enrolled with your practice manager, please wait 48 hours or 2 business days before you attempt to prescribe electronically controlled substance, just to give that pharmacy system step a little bit of time to happen. So within 48 hours, the docs are able to prescribe. Next slide, please. Then what happens when the physician goes to prescribe? What we wanted to have is a nice consistent process, whether it's doing remote access or electronic prescribing, and that's done by using this single app on the cell phone. And by the way, well, I think it comes up in another slide that showing this to physicians really gets their buy-in, because it's really anxiety-provoking to tell them that you need to do this, you need to do that, and they don't get it, and that puts up barriers to their participation. But in the computer, step 1 is, as I'm prescribing a controlled substance, in the computer I'm prompted to re-enter my password. That's not an option. That's required by DEA regs. Not mentioned on here also is that the physician prescribing must re-verify that the prescription that they are about to send is all correct. For example, the quantity, the name of the medicine, etc. It does require, per the regs, a second step to verify. Once I enter my password and hit enter, that sends a message through Imprivata's Confirm ID system. And right on my cell phone, I get the ping that says, do you approve or deny this request? And again, if you're using a watch, the ping and approve or deny button appears right on the watch. And by the way, patients think that's pretty cool as well. So next slide, how successful have we been? Well, within the first 3 months of rolling out multi-factor authentication, we had over 10,000 users enrolled, and we are currently at about 14,000 and change. By doing this, we have significantly reduced the risk of inappropriate remote access to all of the named systems there. As far as EPCS, electronic prescribing of controlled substances, goes, within the first 3 months, not having any enrollment fairs, just doing our enrollment strategy of enroll at your office or enroll at the hospital. We had about 1,500 users enrolled within the first 3 months, and we are currently now around 1,900 users. I'm proud to say that within the first 2 months of go live, we had 82% of our controlled substance prescriptions going out of our system electronically. That's climbed up now to about 88%. And we strongly believe that by doing that, we are increasing the safety of our patients, especially in this climate of opioid epidemic. The patients are more satisfied. They like the fact that when a prescription is needed, a refill is needed, for example, they don't need to drive to the office to pick it up. They can just go to the pharmacy and it's there. And the efficiency gain also for providers is significant, with just such a quick tap on a button and typing in an extra password instead of having to wait for something to print and then manually signing it, and oh wait, it went to the wrong printer, let me do that again. Oh, how am I going to get you your prescription? It's now 5 o'clock and the office closes in 10 minutes. All those issues are out the door. Next slide. So what's next for multi-factor authentication? As Colin stated, we are going to be trying to get more robust with our rollout for VPN access. We are, as far as EPCS goes, we'll be helping operations ensure that they are 100% compliant with the Pennsylvania state mandate that occurs in October of this year. By the way, our organizational encouragement came from our CEO and from our medical group president that we really should be doing EPCS now. We should not wait for the October deadline, because we believe this is the right thing and it's safer for our patients now. Within the last year or so, we also expanded out farther west into a health system formerly known as Summit Health, and we'll be working with them to make sure that their EPCS requirements are met. And as they migrate into our Epic system later next year, we will make sure that they're going to be using the same easy-to-use system. We can go to the next slide. And so here's where I mentioned some of the tips and lessons learned. So the actual process of doing this is really not as complicated as people might think. In fact, some of our leaders in years past had felt that the whole process for doing EPCS is so complicated, nobody's going to want to do it, let's just wait. It was really with finding solutions that make that whole process so less complicated that we were able to get leadership agreements and buy-in to go ahead and proceed. So that was a nice win. And as I mentioned before, actually demoing this workflow to physicians is really how you overcome some of their fears. There were some offices that had refused to enroll because they just, for lack of a better word, they were afraid of the whole process. So I personally went out to a couple offices and showed them how it worked, and they kind of, the light bulb went off. They're kind of, oh, that actually seems kind of easy. Okay, we'll give it a try type of thing. So demoing it at every opportunity will help to overcome those type of barriers. I'm taking a look at the slide here. Force MFA for any user who can access the network. Yeah, so to improve your network security, multi-factor authentication really is necessary these days. We eliminated the need to have enrollment fairs by just having a ubiquitous supply of enrollment supervisors. Having a command center is a really good idea for any significant project, and kind of proud to say that on this one, although we had a command center, it wasn't too busy. We didn't have a whole lot of issues. Isn't that right, Colin?
I agree. And one thing I'd like to interject here, it's not on the slide, but one thing that helped the success of the EPCS project on the whole was having an invested physician champion. I feel that having someone who is not just a project manager trying to force something down someone's throat, someone who can speak on the level of the physician and a respected member of the organization definitely led to the success of the project, because a lot of times communicating between from IT to a physician may meet more resistance than someone who does, sees patients, takes care of patients on a daily basis, and understands the pain that they go through.
And like I mentioned earlier, we had already been using the Imprivata solution for some other aspects, and by leveraging that relationship we already had, and even hardware that we already had, we were able to expand and use a single vendor for all of these solutions, and that we found was tremendously helpful. And next slide. And I'll turn the floor over to Dan.
Great, thank you, Dr. Lackey and Colin, for that great information. And so before we turn it over for questions, I just wanted to provide just a little bit more detail about Imprivata Confirm ID, which, as you just heard, is part of the solution that WellSpan uses to enable multi-factor authentication, including EPCS, across the organization. So if we go to the next slide, we've really designed Confirm ID to be a comprehensive multi-factor authentication platform purpose-built from the healthcare perspective. It's designed as a single centralized solution that enables your remote as well as your on-premise users to access different workflows and data securely, but also conveniently. So what does that mean? Well, with Confirm ID, we allow you to centralize your policy management and reduce, hopefully, your total cost of ownership by leveraging that same single platform for all of your authentication workflows. And that includes things like enterprise single sign-on and virtual desktop access if you happen to be using Imprivata OneSign as well. And we also want to make sure that that authentication workflow is as seamless as possible for your users, particularly your providers. So we offer a number of innovative and convenient and DEA-compliant authentication options, which I'll talk about in just a moment, but that includes the push token notification that Dr. Lackey and his colleagues use at WellSpan, but also hands-free authentication and fingerprint biometrics. And we really try to tailor those authentication methods to the requirements of each unique workflow. We also try to make sure that Confirm ID can extend to meet all of your authentication needs. And we do that by integrating with a broad ecosystem of both healthcare as well as business systems, applications, and workflows. And we try to give you a complete solution for complying with specific healthcare regulations, including the DEA requirements for EPCS, which we discussed. So if we go to the next slide, really from an EPCS perspective, Confirm ID is a comprehensive solution for helping you meet all of the DEA requirements for EPCS, as well as a fast and easy two-factor authentication for your providers. So Confirm ID will give you everything that you need to meet the identity proofing, the credential enrollment, the logical access control approval, two-factor authentication, and then all the record keeping and reporting that goes along with that. And this is where sometimes sort of conventional or horizontal multi-factor authentication products can fall short, because they'll only help you satisfy part of that two-factor authentication requirement, and they don't really give you that complete solution that you're going to need to be fully compliant from an EPCS perspective. And so if we go to the next slide, one of the steps and examples that Dr. Lackey talked about was the identity proofing and the credential enrollment. So just to reiterate, the DEA requires that you validate the identity of all your providers before you enable them for EPCS. And one of the ways you can do this is in-house by checking a government-issued photo ID and making a record of it. Well, Confirm ID is going to give you a role-based utility where you can assign the role of enrollment supervisors. That's where WellSpan uses their practice managers. And these are the folks that are actually going to check the identification of your providers, make a record of it in Confirm ID, and then the next step, which is the right-hand side, is actually help those providers enroll whatever authentication methods they'll use for EPCS. In this particular screenshot, it's fingerprint biometrics, but it could also be their phone. And now you've completed the identity proofing, and then you've bound the identity of those providers to the two-factor authentication credentials they'll use for EPCS in a very fast and convenient way, all of which takes about 2 to 3 minutes per provider, and you have the necessary records and reporting capabilities for those. So if we go to the next slide, Dr. Lackey mentioned the logical access control process, and this is where you actually configure your EMR or your e-prescribing application to give your providers permissions to do EPCS. Now, within this logical access control piece, there's 2 steps. There's the folks who will actually configure the system to give those providers permission. And before you can turn that on, you need a second individual or set of individuals to approve that. And so Confirm ID also enables the role of EPCS access approver. And again, those will be those second sets of individuals who will approve that EPCS permissions have been given to the right providers. And there's an authentication that can happen within Confirm ID so that you can capture that validation. And now from one central location, you have the reporting on the identity proofing, the credential enrollment, and now the access approval as well. And if we go to the next slide, we know that if you're considering really adding multi-factor authentication to any workflow, but in particular EPCS, you want to be very mindful of the potential impact that has on workflow. So if you put up a two-factor authentication requirement for anything in front of providers in particular, you run the risk of dissatisfaction and inefficiency and maybe reducing adoption. So Confirm ID tries to address that by giving you the broadest range of authentication options, including those that are DEA compliant. And so that should hopefully do a couple of things for you. One, it's going to give you the flexibility to mix and match whichever options best meet various workflow requirements. So we know that, for example, for the occasional user coming in through remote access, something like a password plus a hardware token that they type over those 6 digits, again, is probably okay for that occasional access. But that might not be efficient enough in a fast-paced care setting for something like EPCS, where you may want a fingerprint biometric plus a phone-based token with that push to accept as a much faster way. So Confirm ID is really going to give you all the different options to satisfy all those requirements. Now, the second thing that'll do is give you backup, which is particularly important for EPCS as more and more states and even the federal government starts to mandate electronic prescribing. Paper is no longer going to be an acceptable fallback, so you may want to make sure that your providers always have an option of doing EPCS with that second factor of authentication. And so something like a fingerprint biometric is a good fallback in case a provider doesn't have their phone or the battery's dead or something like that. And to further streamline convenience for you, Confirm ID is only going to present the authentication modalities that that user has enrolled and that are available to them in that particular workflow or that particular workstation. So again, the 2-factor is going to be in line and always adapting to that provider's workflow and what they have enrolled, all designed to make that as fast and easy as possible for your providers. And then if we go to the next slide, especially important for EPCS is the record keeping and reporting, maybe the most important. The DEA wants to establish what it talks about as non-repudiation with absolute certainty in an electronic prescribing system. And we often refer to that as an electronic or an auditable, secure chain of trust. And so that's why they have all of these different requirements, the identity proofing, the credential enrollment, 2-factor, etc. But in order to prove that non-repudiation, you have to keep records of all of this. And you have to keep that in a readily available, easily accessible way. And so Confirm ID is going to give you that centralized repository, which, along with the reporting that your EMR will give you the complete holistic view into the EPCS process so that you can help establish the non-repudiation, particularly in the event of an audit or something like that. And then finally, if we go to the next slide, the last thing before we sort of open it up for questions here is I just wanted to make people aware of some of the things that are happening from a regulatory perspective that are really driving EPCS and creating some urgency around this. A number of states have passed or are considering EPCS requirements as one mechanism to fight the opioid epidemic, because if you take the paper script and the DEA number out of the patient's hands, you reduce the risk for diversion and fraud. And so you can see here, there are actually now 15 states that have passed EPCS regulations, 3 of which are currently in effect, and the others will take effect over the next year or 2. Now, in addition to state regulations, in October of last year, the Support for Patients and Communities Act was signed into law at a federal level. And so that was a broad legislation with a number of initiatives designed to address opioid abuse. But one of the components was an EPCS requirement for all controlled substances prescribed as part of a Medicare Part D program. And so by January of 2021, any prescription for a controlled substance for Medicare Part D must be sent electronically. Now there's 45 some odd million patients that participate in these programs nationwide. So that's something to consider if you have patients, even if you don't see your state up here. And then the last thing that I'll say is that Walmart last summer announced that starting in January of 2020, so a little less than a year from now, they will only accept electronic prescriptions for controlled substances. So again, if you don't see your state on here from a state mandate perspective, but you have a significant enough portion of your patient population that uses Walmart Pharmacy, be mindful that by January of next year, they're only going to accept electronic prescriptions for controlled substances. And so therefore, you'll need to have all of the components that we just discussed in place from a DEA perspective in order to comply. So with that, I'll now turn it back over for questions.
Thank you so much, Dan, and thank you to Dr. Lackey and Colin as well for that fantastic presentation. Before we jump into the questions, we are going to launch a couple of poll questions to the audience to gather your feedback and where you are in terms of this process. So we'll have two questions here, and you can go ahead and select the answer that best applies for each of these questions directly on your screen. The first question is, do you currently have a two-factor authentication solution? And if yes, which vendor do you use? We'll give you a few moments to respond here. Then we'll dive into our second poll question. Fantastic. Thank you so much for everyone for filling out that first poll. We'll move into our second poll question here, which is, do you have or plan to purchase a two-factor authentication solution for e-prescribing of controlled substances, or EPCS? We'll go ahead and launch that now. And again, you can fill out the answer that best applies to you by just selecting it on your screen. And again, while folks are filling out this last poll question, I did want to thank Dr. Lackey, Colin, and Dan for that wonderful presentation today. We really appreciate your expertise. We're going to dive into some questions that have been coming in from the audience, and I'll turn the floor over to Laura Dierda for that.
Thank you very much. We will now begin today's question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We will try to get through as many questions as we have time for today. First off, I have a great question here from one of our attendees. The question is for Colin. Are they using VDI, and if so, how is MFA integrated into their VDI end user devices?
This is handled through Citrix. So all of our virtual desktops are behind the Citrix Access Gateway, and it's whether they have the endpoint client or they go through the web interface.
Great, that's really helpful for us to understand. The next question I have here is for Dan. Is the approve or deny button on the phone or watch because of SSO?
Sure. So that workflow is the push token notification. And so the way that works is it's a mobile application on the provider's mobile device, and it's looks very much like a conventional token generator, generating a 6-digit code every 30 seconds. But instead of having to manually type that over, a notification pops up on the lock screen, and the provider can press approve. Now that can be used by providers for EPCS as well as your entire organization for some of the other multi-factor authentication workflows. Now, in the case of the Apple Watch, it gets pushed. You can configure it so that it gets pushed through the phone to the watch as well, so that the provider or any user can push that approve button from their Apple Watch. Now that is a functionality of Imprivata Confirm ID, which is a separate solution from Imprivata OneSign. That's our enterprise single sign-on. However, they do all use the same core infrastructure, same Imprivata appliances. The administrative console has the same look and feel. It leverages the Imprivata endpoint agents. So it is a separate solution, but again, builds off the infrastructure that you already have if you are an Imprivata OneSign customer.
Great. Thank you very much for clarifying that, Dan. The next question we have here is for Dr. Lackey. Did you run into any issues with users not having smartphones? And do you have physical tokens as well?
So that's a great question. As you can imagine, it's pretty rare that someone doesn't have a cell phone these days. Again, our kids or 10-year-olds all have cell phones, right? But we actually did run into one or two that some of the maybe older physicians that are practicing in a really rural area and just did not want to have a cell phone, period. WellSpan's organizational decision was that for remote access and for EPCS, really your only option is to use a cell phone or a cell phone-like device. So we did allow flexibility that technically someone could use a device like an iPod Touch and use it in Wi-Fi mode, or they could use an actual cell phone device that simply did not have a cell phone vendor plan attached to it, again, using it in Wi-Fi mode, basically just as a computer. And we even had suggestions go out in our emails to folks that what you can do is go to Amazon and you can purchase a really inexpensive cell phone device for as little as $59. And again, don't purchase a plan to go with it, and just use it in cell phone in Wi-Fi mode. And by using that, you can do your remote access in EPCS. And to not try to make this story too long, that we did the one provider that did that, and wouldn't you know it, in January of this year, it all stopped working. Why? Because the cell phone he bought could not upgrade to the necessary operating system to support the upgrades to the app. So he actually had to go out and buy a second cell phone, cheap, still only $25 or $50. So things like that do happen. And I'm trying to pull up the rest of the question here.
Great. And thanks for that informative response, Dr. Lackey. Here's another question from an attendee for you. Do you allow your prescribers to use their phones to prescribe or prescribe EPCS, or do you have another token besides their phone?
So because WellSpan's choice was to use only cell phones as the token, and because the DEA regs say you may not use the same device that you are prescribing on to also use as your token, we prohibit that. We prohibit it with policy, though. We very carefully explain to our physicians that if you were to download and install the Citrix Receiver app onto your cell phone, it's technically possible that you could use Citrix Receiver to remotely access our system, and with a lot of resizing and scrolling around, it would be a very unpleasant experience. You could technically get into our EHR and prescribe a controlled substance, and then Imprivata ID would present you with the approve or deny button on that same device. And if you do that, you are breaking not only WellSpan policy, you are breaking DEA regulations, and you are then going to be subject to DEA sanctions, like maybe losing your DEA certificate. Fortunately, the mobile app that our EHR vendor uses on the phone does not support prescribing of controlled substances. Similarly, the app for the iPad does not support prescribing of controlled substances. So we try to make a real hard line explanation. You must be prescribing on a computer and use your phone only for the two-factor authentication.
Thank you very much, Dr. Lackey. And I do have just one more follow-up question for you along this line. Best case scenario, how long does it take to set up a prescriber? I mean, up to the point where you let them know it can take up to 48 hours to actually prescribe.
2 minutes, best case scenario.
2 minutes.
Yeah, so I mean, when you have a brand new enrollment supervisor who is not familiar with the software, it's pretty intuitive. So it might take them 5 minutes the very first time they do an enrollment, and then on their second enrollment, it takes them 3 minutes, and the third enrollment takes them 2 minutes. And then if they have a line out the door, they'll be able to get through each physician in about 2 minutes each. Really, the lag time is if the physician presents themselves for enrollment and they have not yet downloaded and installed the Imprivata ID app onto their phone. That can take a little bit of time depending on network speed. But we told all our physicians, when you're going to go enroll, make sure you downloaded and installed the app first, because that's necessary to complete the enrollment process.
That's a great and thorough response, Dr. Lackey. Thank you. Now, Dan, we have a question for you. One of our attendees would like to know whether the audit records stored on the premise or in the cloud by Imprivata.
Sure. So all the audit records that Imprivata Confirm ID will generate, and that's things like the identity proofing event, the credential enrollment, the two-factor authentication for the workflow itself, including any that may have failed, you know, what endpoint, what user, etc. All of those records and reports that get created are all stored on-premise in the Imprivata appliance, in the hardened appliance. And if you're familiar with the Imprivata appliances or the administrator console, then the reporting looks very much the same as a lot of the one-sign reporting does. And there's built-in reports and canned reports for Confirm ID specifically, as well as some custom configurations you can do. But those are on-premise in the hardened Imprivata appliance.
Fantastic. Thank you so much, Dan. And now I have another attendee question for you. Is the Walmart mandate for January 2020 just for the states listed, or is it for the entire country?
Yes, that's a good question. And sorry that wasn't more clear on that slide, but no, in June or July of last year, in the summer, you know, Walmart issued a press release announcing several initiatives to address the opioid epidemic from its perspective, one of which was that starting in January of 2020, it will accept only electronic prescriptions for controlled substances across the board, every state in the U.S. You know, now we haven't seen too much more follow-up on that, but in order to send electronic prescriptions to Walmart to get those filled for your patients, you have to have a DEA compliant system in place that you know, has all the components and steps and things that we've stepped through. So no, that Walmart initiative applies to the entire U.S.
Fantastic. Thank you for the clarification there, Dan. And then I have one more question for you in terms of clarifying an implementation of the EPS system. When implementing the EPCS, across a multi-EMR environment, do you have tips for establishing a consistent workflow?
Yeah, that's a good question, and something that's, you know, certainly very important, right? You want to create familiarity and consistency for your users. So a couple of things. Every EMR or e-prescribing application has different partnerships and different integrations to enable that two-factor workflow. Imprivata does work with most major EMRs and e-prescribing applications. However, in a couple of cases, there are some limitations in what we can and can't support. So it really depends on what applications you're talking about. In most cases, all of those different modalities we talked about, the password, the hands-free authentication, which delivers that token Bluetooth completely wirelessly, so no interaction required at all with the phone. The push to accept token, and then fingerprint biometrics, all of that can be used across most EMRs. Again, there's some limitations, but you know, if Confirm ID does work with all the EMRs that you have in your environment, then one instance of identity proofing, one instance of enrolling credentials is all that's required for one physician, and then they can go back and forth across your different systems using Confirm ID. So I would encourage, you know, the asker of that question to reach out to the Imprivata team and let us know specifically what your environment looks like, and we can tell you all the options that are available to make it as consistent as possible.
That's a great point. Thank you so much. And we do have several questions rolling in here. So Dr. Lackey, the next question is for you. How do you handle re-enrollment if a provider upgrades their phone?
So that's a good question also. What is required there, and this will be the same situation if someone gets a new phone, or if they if they maybe leave, a similar situation is if they leave their phone at home and show up to work, wait, I forgot my phone, what should I do? All those types of situations require some sort of on-the-fly solution. And so that's one of the reasons we wanted to have practice managers available or an enrollment supervisor, i.e. the practice manager, available to help solve those situations as they arise. And because as was kind of described earlier, you can educate as much as you want, but that only goes so far. So what happens is the physician finds, wait, it isn't working anymore. Why isn't it working? You go to the practice manager. Why is this not working? Oh, it's a new phone. We have to re-enroll it. Here, let's get into the enrollment app right here on my computer, and we can enroll your new phone. By the way, we need to get in touch with one of our enrollment managers, I think the term is, in our at our help desk, to unenroll your old phone and make sure that that phone that you just turned in at the T-Mobile store can't be used by anybody else. So we have to get the old phone unenrolled as well. Similarly, when the physician says, "Oh, I forgot my phone at home. What am I going to do today?" Well, your options are don't prescribe today. See if you can stack up your prescriptions and wait and do them tomorrow when you have your phone with you, if that's possible. Or we told our offices you could have a spare device available and enroll it for that day for that physician that left their phone at home. It can be, again, an iPod Touch or maybe a cell phone that the office uses as their camera, and then maybe unenroll it at the end of the day. So when the doc comes in tomorrow, they have that. Real quick, I'm going to also jump off this question and mention when it comes to selecting what device you want to use as your second factor device. Again, WellSpan chose to go with cell phones. We initially had thought we were going to use we're going to try out some tokens as well, or maybe some fingerprint readers. And what we heard from other organizations was, you know, if you say you put in the fingerprint readers in the ER, and then on the floors you don't use those, or you use the tokens here and the fingerprint readers there and the cell phones there, then what you end up with is dissatisfaction with your users, because it turns into a haves versus a have-nots. You know, then you get people arguing, well, I want the fingerprint reader too. And we said, you know what, let's just bag that idea of different devices in different places. We're going to use cell phones everywhere. So it's a one-size-fits-all, and we're really pleased that we went with that decision.
Fantastic. Well, that is all the time we have for today. I want to thank Dr. Lackey, Colin, and Dan for their excellent presentation, and Imprivata for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.